plans and what that means for your student and for you as parents. We have some experts here tonight to give you the information that you need and to kind of answer your questions at the end if possible. But before we get started, I want to talk to you about our department. FACE is the acronym for Family and Community Engagement. Our office is relatively a new office for Charleston County School District. We're here to make sure that we serve the needs of our parents and our students. We want to be a hub for the school district where we connect the different departments of Charleston County School District that deal with any aspect of family and community engagement. We connect them to the parent for the best interest of our students. We also connect them with community partners. And as a district, we want to make sure that our parents are informed and have access to the resources that they need to support their students academically, socially, emotionally, in any way that they can. So if you have any questions about our department, you can reach out to us. We will have our number posted. You can reach out to me as the director. For this particular feeder pattern, we have Ms. Carly Ash, who is the FACE officer for Lucy Beckham and Wando. In our office, we also have Ms. Danielle Daniels. She is the FACE officer for the Burke High School feeder pattern, as well as Stahl. We have Ms. Monique Shingler. She is the FACE officer for James Island High School, St. John's High School, West Ashley High School, and Baptist Hill. And I am the FACE officer or director that governs the North Charleston High School feeder pattern. So I'm going to turn it over now to our expert for tonight, Ms. Elizabeth Young, and she's going to talk to you about 504s and what you can do to assist your children. Thank you. Ms. Young?
Thank you. My name is Elizabeth Young. I'm one of the directors in the Department of Exceptional Children, and today we're going to talk about understanding your child's disability rights under Section 504. Section 504 is a federal civil rights law that protects students from discrimination based on disability. So no students, by reason of their disability can be excluded from participation in or denied the benefits of or be subjected to discrimination under any program receiving federal financial assistance. With Section 504 eligibility, we have to start with a physical or mental impairment. After that is established, we look at whether it substantially limits a major life activity. And that determination is made by a group of knowledgeable persons that is your school 504 team. When we look at that eligibility, we look at all students, students with impairments, and all students with impairments aren't necessarily 504 eligible. But if they are, that provides them with protections, and every child that is IDEA eligible or special education eligible is also protected under Section 504. So with 504 evaluation, that is the first step in the process. It requires parental consent or consent from a student who's over 18 or who's reached the age of majority. And a medical diagnosis might be one source of information to establish that evidence of a mental or physical impairment. We do need to assess the specific areas of educational need, collect data from a variety of sources. Those could include assessments, interviews, surveys, observations, or records review, and many people on the team might be providing information. It could be health professionals, the parent, the student, teachers, and any specialists that might need to work with the child, like an audiologist or a vision specialist. Your involvement as a parent in the evaluation process is critical. So not only is that consent for evaluation required, the information you share with your school team can help inform that eligibility decision. If you provide a release of information for us to be able to talk to health professionals that are involved with your child, it can help the team collect the necessary information to establish that physical or mental impairment. Having those health records, any private providers who work with your child might have information that is useful for the team. Also, actively participating in interviews and team meetings is extremely important. Remember, school access and participation. That's the purpose, the underlying purpose of the 504 plan and 504 eligibility, to ensure your child has access. When we are looking at that eligibility process, we want to make sure those disability barriers are identified and focused on, but we also need to look at the strengths and abilities of your child as well. So when we come to that table with all the evaluation information that's collected, we are going to look at the impairment information, and establish that there is a mental or physical impairment. We're going to describe the characteristics of that impairment for your child. Many times we look at the characteristics of an impairment as very broad. We narrow that and look at what does that mean for your child. Then the team would consider the major life activity or bodily function that is associated with that impairment, and determine whether it is substantially limited compared to the average student. The most critical part of that process and eligibility is really determining what are those disability-related access barriers. When we look at major life activities, I've included some here on the slide. It's not an exhaustive list, but it is a list that is pretty comprehensive in the things that we would be looking for. It doesn't necessarily have to be learning, and that's why learning is not here. We look at that major life activity in the context of all of these major life activities and not just for learning. And the substantial limitation decision by that team needs to be made on a case-by-case basis. When the impairment restricts the conditions, manner, or duration of the major life activity compared to an average student, that is considered substantial limitation. It doesn't have to prevent or significantly or severely restrict performance. For example, a child who is deaf would be considered severely restricted, but a child with a milder hearing impairment may also be eligible under Section 504. So as far as special considerations in that eligibility determination, if the impairment is episodic or in remission, the team has to consider that through the eligibility lens when it's active. And the same with mitigating measures. We need to consider that if mitigating measures are not in place. With temporary or transitory impairments, we're looking at it a little bit differently. The expected duration and extent of the actual limitation are what needs to be considered by the team. In that case, one concussion may be a temporary impairment, but a child who has had multiple concussions, or it has gotten to the point where we are looking we could even be looking at traumatic brain injury, then the team would need to consider those factors. As far as eligibility determination outcomes, your child may be found not eligible if there's not a documentation of an impairment and or a major life activity is not substantially limited. Your child could also be eligible without a plan. We would reevaluate the child every 3 years. We wouldn't have annual reviews because there would be no accommodations plan. And that's where we would be looking at those disability barriers. If there aren't disability barriers, we don't have a reason to put in accommodations. It is documented in our information systems, and the child does have protections under 504 if that's how they are designated as eligible without a plan. And then if children are eligible with a plan, you would expect to meet at least annually and for 3-year eligibility determination reviews. And there's a manifestation determination or a reevaluation prior to any disciplinary change of placement. So with the 504 accommodations plan, it needs to be designed to ensure access by addressing the disability barriers. For example, if a student has ADHD, the barrier might be organization, and we might have a checklist to make sure they got everything in their book bag for homework every day. And it is designed to meet individual needs. So services to support accommodations may also be included on a 504 plan, and the staff must know and implement the accommodations written into the 504 plan. Your child's rights include an evaluation prior to the determination of eligibility determination. That evaluation may not be as extensive as some other evaluations, like for a special education or IDEA evaluation, but it still is an evaluation where a team is looking at the information that is available and determining if there is a physical impairment that substantially limits a major life activity. They are also entitled to an appropriate education designed to meet their individual educational needs as adequately as the needs of non-disabled students. They should have free educational services except for the fees that are imposed to non-disabled students. They should be able to participate in general education settings with non-disabled peers and have periodic reevaluations, including a reevaluation or a manifestation determination review prior to a disciplinary change of placement. And I'm going to talk about that more right now so that you understand what that means. So that reevaluation or manifestation determination review is held prior to a referral for a disciplinary hearing and prior to the 11th day of cumulative suspension. So the purpose of that meeting is to evaluate or determine, was that conduct caused by or directly and substantially related to the child's disability, or was that conduct a direct result of the district's failure to implement the 504 plan? As far as your parent rights, the parent rights include that provision of consent prior to an evaluation of your child initially. The evaluation, eligibility, and placement decisions are made by a group of persons, including persons knowledgeable about your child. Notice prior to any actions regarding the identification, evaluation, and placement of your child and a review of your child's educational records. I think it's important to also understand how to resolve disagreements. Many times you need to actually start with your school team. Share your concerns and seek understanding during your 504 team meetings. Listen closely when the teachers describe your child's performance in class, and ask clarification regarding school staff observations and proposals. When you are sharing information, share specific examples of the impairment-related barriers that you observe. That's information that the team will use to resolve any of those disability-related barriers that you're observing. As far as requesting assistance, in addition to your school-based leadership team, the District 504 coordinator, and that is me, works to address parent concerns related to 504 protections and implementation. My information is included here, but it's also on the district website. As far as the complaint procedures, you can file a 504 grievance, and that would be filed with me for any complaints not related to your child's identification, evaluation, or educational placement. For any complaints related to identification, evaluation, or educational placement, you would request in writing an impartial hearing regarding your concerns. It affords you the opportunity for parental participation in the hearing, representation by an attorney, and possibly a second impartial review. At any time, parents can file a complaint with the United States Department of Education's Office for Civil Rights. They are the oversight entity that investigates alleged disability discrimination. Under Section 504, it can be discrimination if schools don't provide accommodations that help them access regular school activities, or improperly exclude children with disabilities from participating in educational services. Parents who think that their child has been discriminated against may file that written complaint with the OCR within 180 calendar days from the denied participation. So I wanted to end on a more positive note now that I've given you information on how you can address some concerns if you have them, if they come up in the 504 process. As far as tips for student success, encouraging independence and self-advocacy. Those are things that we do naturally as parents. A lot of times when we have a child with a disability, we are focused on the right now, but we also need to be focused on that long-term perspective. We need to teach responsibility through routines and expectations at home, establish those healthy sleep patterns, balance those home activities and school expectations. Really focus on the process sometimes instead of the product. Many times when we look at students, we have a tendency to compare them to other children. Not only do we need to work on that aspect of how we perceive things, but also helping your child focus on their progress rather than peer comparisons. And develop partnerships with your child's teachers. That is a foundation throughout your child's educational career that will benefit them and also teach them how to advocate for themselves. I've included some resources here. These are also easily accessible on the website. the Protecting Students with Disabilities, Section 504 Notice of Parent Rights, that's on our CCSD website, and Section 504 Discipline Fact Sheet, excuse me. Again, my name's Elizabeth Young. I'm the District 504 Coordinator and an Interim Director in the Department of Exceptional Children. If you have any questions, please don't hesitate to reach out to me.